And joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University's Feinberg School of Medicine. Good morning, Dr. Murphy.
Hey, good morning.
So we just mentioned these COVID cases continue to rise here in Illinois. Vaccinations are rising, which is good, but you don't want to see these cases rising. What's going on here?
Well, we've decreased the mitigation efforts. People are wearing masks, which is great, but we've allowed more mobility in the population, and the restaurants and bars are getting fuller, and people are traveling more. Plus spring break with the students who are bringing the virus back from wherever they're going. So, you put all that together and the numbers creep up. And this is in addition to these new variants that are out there that are easier to transmit.
Dr. Murphy, I wanted to ask you about one of those variants that's in Brazil. We're seeing an increase in both illness and death in younger people, which is something that we really haven't seen worldwide. What do you believe is going on there?
Well, you only have to look back to the 1918 flu pandemic, which there's not too many people alive that were back then. But, we have books written about it. And that was an epidemic that also targeted young people. And this variant that's in Brazil, it's called P1, appears to be targeting younger people. And this is very disturbing.
And speaking of the variants, I'm sure you've answered this question before, and it keeps coming up from people that I talk to, but in the note you sent, I said like 27 variants have been identified. And do we know that the vaccine works against all of those variants, or is that still to be determined?
Well, it's still to be determined exactly, but we know the common variant, the B117, which is from the United Kingdom, apparently is protected. The vaccines do protect them. And you see in Europe, all the cases are going up except the United Kingdom, where they're going down. And that's because they are pushing the vaccine out there so rapidly, and they're using whatever vaccine they can get their hands on, including the AstraZeneca one. So it looks like for that variant, we're okay.
Dr. Murphy, I know a few parents that have signed their children up at Lurie to be part of the vaccine trial. It looks like now they're going to be starting this trial on infants and young children. Your thoughts on that?
Yes. No, it's great. If you look at vaccines worldwide, the most likely person to take a vaccine is a child. They're the ones that get vaccinated. The adults get some Pneumovax and flu shots every year, but the kids get vaccines really to everything, and it's going to be for COVID too. So the Pfizer vaccine is approved down to age 16, and they have just finished their enrollment in the 11 to 15 category of that study. So that's going to go down to 11 years pretty soon. And then, like you said, at Lurie, they started the new one 6 months to 11 years of age.
All right, let's go to some viewer questions. This is a good one. Are there any new treatments for COVID once you get it? When I had it, the hospital told me to go home and come back if the symptoms became serious. That was in October. So where are we at when it comes to treatments when people actually get COVID?
Marcus, this is a really good question. At the beginning of this thing, we put all our chips on the vaccine, thinking that if we could just vaccinate everybody, this thing would just go away. Obviously, we're going to still have problems. There's at least 3 drugs that are in development right now that would be a great addition to our treatment armamentarium. They're being studied as we speak, but you would get tested. They would not tell you to go home. They would give you a drug for 5 days to get rid of the thing rather than wait for your body to get rid of it, which in 85% of people works, but in 15% end up in the hospital or really sick. So, those are coming, but, they haven't been prioritized. And so, they're kind of slugging their way through the development process, and there needs to be more attention paid to those. We do have monoclonal antibodies, and you have to take them early. And people are not utilizing these. I don't understand why. They're approved, they work, they're safe. If it's early on in the infection, you should take the monoclonal antibody if you have any risk for severe disease. So.
It's good to know.
Second question. I finally have gotten an appointment for my first vaccine dose today. Can you give me some advice on how to prepare? I think there's been all this confusion about can you take Tylenol, can you take Advil, should you move your arm after you get the dose? What would you recommend, Dr. Murphy?
Just relax.
Just relax.
People have no serious side effects at all. It's a very small percentage of people have any real problem with these vaccines. Look how many millions have been given out. And, no one has died from the vaccine. It's a very small percentage. So just relax. You can plan having your I'm vaccinated party 2 weeks after your second dose, and just don't take anything. Don't do anything. Just go there and get it.
Here's another one. In April, the state will be opening up vaccinations to anybody over 16. What vaccine is approved for 16 to 17-year-olds?
Yeah, we have the 3 approved vaccines here. The Pfizer vaccine is approved for age 16 and older. So that would be the only one a 16 and 17-year-old could take right now. That's going to change as these get done.
Dr. Murphy, thank you so much. Have a great weekend.
Okay, have a great weekend yourself.
And if you have a question for Dr. Murphy, head to our Morning News Facebook page and post it there. We'll talk to him again on Monday. Hey, Paul.